Hello, and welcome to a video series explaining consent to trial. This video aims to explain to young patients with cancer and their families what taking part in a trial may involve, and what happens to the information that we get from them. So what does being in a trial actually involve? This will vary from trial to trial, but mostly it will be coming in for your treatment and tests. Depending on what the treatment is, this may mean coming into hospital more or less often. Sometimes, new treatments can only be given in the hospital where the trial is happening, and so you might have to travel there for your treatment. In the southwest, this will most often be the Children's Hospital in Bristol. Another thing you may be asked to do is let us know how you felt during your treatment. This might mean you're asked to keep a diary of any side effects you experience, or notify us if you become unwell. Participants have protected rights in trials. These are the same as patients always have, with some extra ones that apply only to trials that we'll talk about now. Firstly, you have a right to leave the trial whenever you want. This is called your right to withdrawal. If at any point you wish to leave the trial, you're allowed to do so and can return to standard care. Secondly, as a participant, you have a right to find out the results of the trial. This obviously can't happen until the trial is over, but if you want to find out what the overall outcome of the trial was when it's finished, you're entitled to do so. Thirdly, like any patient, you have the right to confidentiality. However, in a trial, some data needs to be kept about you and your treatment so that results can be analysed. This means that patients have to be made anonymous. This is done by assigning codes to patients, like Patient A. Information that goes in the trial will be things like Patient A received a treatment on this date, or at 5 years post-treatment, Patient A continues to be in remission. Things like names, addresses, and phone numbers will not be part of the trial data. In a trial, the data from lots of patients is put together so that we can get the best answers to a clinical question that's being investigated. When we have the data from all the patients in the trial, doctors use statistical tests to see if there are any differences between the new treatment and the standard treatment we give now. Doctors then look at these statistical differences and make a decision about whether they correspond to a difference that actually matters to patients. Then, this will be written up into a report called a paper. This will be sent to journals to be considered to be published. A group of experts will then check the paper in a process called peer review. This is to make sure that the trial has been performed well and the paper does not make any claims that can't be shown by the data. Then, the paper is published and will be available to other doctors to read. In time, standard treatment may change based on the evidence that trials provide. Finally, thank you for considering taking part in a trial. If you do choose to take part, it is a very generous act on your behalf. By doing so, you'll be helping to improve the care of patients in the future. Thank you for watching this video. I hope it helped explain what the rights of participants are and what happens to their data. 2 other videos are available in this series. One that explains how trials work, and another that explains the consent process. You can access them below.